Hi everybody, welcome back to the Addictive Wellness Channel. Today I am very excited to be here with my good friend, Dr. Gayle Randall. She originally got her medical degree at the University of Nebraska and went on to do her fellowship in gastroenterology at UCLA, and she's board certified as an internist and in gastroenterology. And she is an absolute pioneer in the fields of integrative medicine, functional medicine, and this is going way back before those things were popular. She was a real early mover in those fields, and she is specializing also in addiction medicine, in hormone health for both men and women, anti-aging, weight loss, such a broad field of expertise, but also in the area of mind-body medicine, which I think is really wonderful. So thank you, Dr. Randall, for joining us and bringing this wealth of wisdom that you have to share with folks who are watching at home.
Oh, what a nice introduction.
My pleasure. So what originally drew you to the field of medicine? Was it something you wanted to be from a very young age, to be a doctor? Or
I did. I had a whole stable of like baby rabbits, and all of the injured animals in the neighborhood would end up at my house, and I'd be feeding and I'd release them back into the wild. So I was always a caretaker in that way. I first thought I was going to be a vet.
Oh, okay.
Yeah, but I actually got into Ames, Iowa, which was more competitive than medical school. But I at the very end, I realized that people needed more help than animals did. So that's why I chose people.
Oh, that's very sweet.
And they still do.
Animals seem to have a little bit more still of a connection to nature that teaches them how to take care of themselves.
They're more mindful. Everything we go about trying to learn, they're there. They're in the moment.
Right.
They're present.
Yeah.
So they don't have all that stress that we suffer.
I hadn't planned to ask this, but as that comes up, do you think is that connected to us being more aware of our impending demise as people with a finite life that animals are not so aware of, or what do you think causes animals to not be so stressed?
I just think they live in the moment.
Yeah.
Yeah. They don't think about the past. They don't think about the future. They only think about right now. And that's what we're all practicing to do, so we can be more healthy. Yeah.
Yeah. And so many people end up going to medical school. Most don't end up in the field of integrative medicine. At what point did you kind of veer off or get pulled in that direction?
Very early on, actually. When I was a medical student, and we were offered to go to outstate Nebraska. I'm from Nebraska.
Yeah.
Or because I had to pay my way through school. So that was the most economic way for me.
Right, I understand. I was the same.
Yeah. So anyway, I had the choice to go to outstate Nebraska and spend it with Little Country Doctor or go to the Indian Reservation. And I chose the Indian Reservation. I actually chose both because I'm an overachiever. But I really first chose going to the Indian Reservation, and some very special things happened to me there. There was an incident where a lady got blown up by her propane tank. I was the doctor there. The doctor goes on vacation when the student comes. So I was the doctor, even though I was a medical student. Yeah. And there were no helicopters that came to the Indian Reservation at that time. This is the middle of South Dakota. So they either had to drive from Sioux Falls or Rapid City and with an ambulance. And so we called. Of course, I did everything I could do to revive her, Western medicine-wise. Right. And her eyes were, I was looking at your eyes. Her skin was about the color of your eyes.
Oh, yeah.
She was blue. She wasn't breathing well. And so I told the young man that was there, that was helping me, I said, go get all of her relatives. Go get them all. Get everybody that knows her. Bring them here to pray for her. And so they did. And they came, and by the end, and then by the time the ambulance came, she started turning pink again. Wow. And then at the very end, the young man says to me, the medicine man wants to see you at his house at sundown. And I went, uh-oh. I did something wrong, but as it turned out, it was just quite the opposite.
That's amazing.
They were waiting on their porch, him and his mate, standing there smiling. They said, come in, have dinner with us. And so that was the first meeting, but then they said, come back next day at sundown. And so it became a regular thing. And then they eventually told me that their ancestors told them to teach me their ways.
Wow.
Which was very unusual in the days of AIM.
Yeah.
American Indian Movement, and Lakota being very anti-white. And but they felt something different about me, and they knew that I would be making a difference in the world, is what they told me. So that's how it started. I right away saw people. I mean, I think I was born that way, but I had a system to hang it on. You know, people were not just their bodies, they're their minds, they're their heart, emotions, they're their soul, they're everything, body, mind, spirit, and emotions. That's the medicine wheel.
Yeah.
So, yeah, I was very honored by that, and that I took that with me. And that's how I saw people, and I still do today.
So going on into your medical career from there, you had a different perspective on things.
And then I had many different teachers, and Native American teachers after that. Joseph Real was one of my biggest teachers. I worked with the Yaqui and the Yaqui Dreaming Women that passed me down their teachings. And
wow.
Yeah, and I've been to other cultures, Africa, in Botswana, but particularly the Amazon. I went and learned the teachings of the indigenous people there.
Yeah, that's amazing to pull together the wisdom of so many cultures. Now, when you're picking up the wisdom, as I say, of these cultures, and then you have, on the other hand, the Western medicine that you've been taught, how did you go about, did they ever feel like they were just two different things that wouldn't connect, or did it take some thought or work on your part to kind of, as they say, integrate the two?
Actually, it wasn't work at all. To me, it was just natural. And I have very long legs, so I felt I was bridging the gap between Western and, call it Eastern, but it's not even really Eastern medicine, but, you know, the word we had then was alternative, which was a bad word, because it was like an either or, and I saw it as one thing.
Right.
I still see it as one thing, and I think we all are getting to that point now. I see that when I go to the meetings, and I'm like, yay, you know, everybody's getting to where they think of it that way.
Yeah, it's so wonderful.
But when I was doing it, there was no word for integrative medicine.
So it was just alternative at the time.
It was complementary alternative medicine, or then alternative. You know, there was no word for integrative medicine. I actually happened to be the head of integrative medicine at Miraval, where I was recruited to, where I hosted the conferences to name and define integrative medicine in the year 2000.
You were not just a pioneer, but you really were the force behind creating the name integrative medicine.
Well, I don't know if I was the force. I think of myself as being on the tip of the spear,
right,
and breaking the water. I wasn't even on the official roster for the event, but I was there because I was the hostess.
Right.
Yeah.
Yeah. You when you have the power to bring the people together, I think a lot of credit is deserved for being able to create that movement.
Yeah. You know, or maybe I just have the Forrest Gump effect.
Well, that's magical in and of itself.
Yeah. Yeah.
That's great. So, as you were kind of in that time taking integrative medicine out into the world, was there, you see a lot of the world opening up to it more these days, but was there a lot of friction against it, a lot of pushback from mainstream medicine?
Amazingly enough, I didn't feel the friction. You know, I mean, actually, of course, before all that, I was at UCLA, I became a professor, and we were having the first consensus conferences on different integrative medicines. You know, we had chiropractors. Woo, you know, I mean, but then that was a big deal. Right. We had people that did Reiki, we had, you know, Oriental practitioners, Native American practitioners, and we did a landmark study called the Healing Connection, where we had Native American, Oriental, and Ayurvedic practitioners see how our patients that had reached a dead end, and then added one of those disciplines. Of course, they all did better. Right. Big surprise.
Surprise.
But that was a huge thing then. You know, that was almost unheard of.
Right.
Yeah.
What time frame was that in?
That was, well, it was before I went, you know, so I was still at UCLA, so it had to be before 1995.
So this was like pre-internet.
In the early 90s.
Yeah. So, you know, the internet has been such a boon for people finding out about these things, but to pull something like that off before most people were even getting online and being able to Google health information.
Yeah,
is amazing.
Exactly. Yeah, we didn't have Dr. Google then. But, you know, I thought the dean was going to come take me away in handcuffs, but as it was, you know, he liked it, turned out.
That's great.
Yeah.
It says something about you, I think, that you've been able to manifest the right support along the way at every step of your journey, whereas others who are not so aligned as you may have found more direct resistance.
Yeah, maybe. You know, and God bless them, too.
Yeah, of course. So, in finding your specialty, what led you to gastroenterology? I know you have a practice now where it's very holistic and looking at things from a multitude of different angles, but how did you end up picking gastroenterology?
I don't know. I think it was more metaphoric. I was always attracted to looking into everything, turning over every stone, to get the answer, whatever it took.
Right.
I was giving IV vitamins to my patients when I was an intern.
Amazing.
Yeah, right?
Yeah.
I even turned over a guy that had sideroblastic anemia, and he was getting pneumonia over and over again, and we're giving him IV folate. It turned him around. Of course, I changed his lifestyle. Got him to quit smoking, quit drinking, and got him back to church.
You need all the pieces.
Yeah, all the pieces. But when I was an intern, I was doing that. But yeah, so I was always, internal medicine. It is like looking inside of things, digging down to the root cause, or what we thought was the root cause in Western medicine way.
Right.
And then gastroenterology is looking into, but I loved the technology. I loved both. But the problem with the Western medicine, and still a bit of the problem, is we were taught that it's science is the altar that we draw our tools from. And maybe sometimes it is. Because I don't ever say Western medicine is bad, ever. Right. It's a good thing. But when you combine it with all the other things we know, that's a great thing.
Right.
Yeah.
Absolutely. When you take all the tools, new and old, and you use what works, right? Rather than only taking a certain category.
Yeah.
You can do so much more. I think that's really wonderful.
Yeah.
So, going at the things in gastroenterology, something a lot of people are dealing with today is SIBO. And that's a word that really has just kind of popped into people's awareness. It feels like in the past year or two that it's come into kind of the public conversation, even though, in the medical world, of course, it was discussed earlier, compared to things like IBS and Candida that people, were talking about 20 or 30 years ago already. This is something that seems fairly new. What is going on? Walk us through what SIBO is.
Okay. I think that it's a continuum. All of the things that go wrong with our gut. Our gut is, I say, where life comes from.
Yeah.
And it's a continuum. You have people that have no symptoms and their gut seems to be working pretty good. And then you have people that have symptoms. And then you have people that, over here on this end, which may have C. difficile colitis, super bad dysbiosis, leaky gut, and SIBO.
Right.
So it's, we're all somewhere in there.
Right over here, they've got all the big stuff going wrong.
Sorry, I didn't mean to put on you.
No, I didn't perceive it that way at all.
Okay. So I mean, is it happening more frequently? I think so. Is it because we're recognizing it more? Possibly. But there's a lot of things we have now that we didn't have then, you know? And I don't mean just in a diagnosis sense. I mean, if you really want to get to the root cause, because I do stool testing.
Right.
Okay, and I really think that's a key thing.
Yeah.
I got to listen to Dr. David Brady this last week at the Academy for Integrative and Holistic Medicine, and I'm always very happy when people substantiate my beliefs, because it's fun, because they do the research, the hardcore scientific research, not that I don't do any, but and then I go, oh wow, well yay, that was what was
nice
right.
To see when that comes around, right?
Right. So, and he ended up substantiating that, there probably is more SIBO now, because he talked about the microbiome, but of course SIBO was part of it, and dysbiosis and leaky gut and everything. But my whole approach with SIBO is that I don't go straight to antibiotics. The rifaximin that they have showed up. I mean, when did they discover SIBO? Someplace at Cedars-Sinai, someplace in the.
I don't know the exact date of discovery, but it was
a while ago, and they found that there was these increased gases that were performed.
Right, like you have hydrogen gas and methane gas coming out of
But the methane gas apparently lives partly off the hydrogen gas, which I thought was interesting.
How interesting! So, before we go further into that, just for people who are hearing SIBO
for the first time.
Tell a little bit about
well, see, most of the time,
what's going on there?
What's going on there is, most of the time, most of the bacteria in your gut is in your colon.
Right.
And then when you get SIBO, it's small intestinal bacterial overgrowth. For some reason, they move north, and they go into your small bowel.
Yeah.
Now, why do they go in your small bowel? I don't think is well understood.
Right. There's kind of a variety of reasons. that are being thrown out there, but nothing is definitive yet.
Mm-hmm. So that's what happens. But I believe it also has to do with what is your microbiome.
Mm-hmm.
Do you have more methane-producing bacteria in there? And what is causing that?
Right.
Yeah, I think is what the root cause is.
Yeah.
And I have some, theories about that. But
what might people be experiencing symptomatically?
Oh,
first?
they could.
Because people will hear this and say, "Oh, SIBO, I have no idea."
Mm-hmm.
Is that something I need to worry about? What would be the symptoms that one would look for that maybe?
Okay, it's mostly constipation prone, although diarrhea can be seen.
Mm-hmm.
They get extreme bloating. Extreme bloating, I mean, like pregnancy.
Oh, wow.
Big.
Yeah.
And gas, passing gas, but pain can be abdominal pain. But the most prevalent symptom is bloating.
Right.
Bloating and gas and constipation, but diarrhea can also be part of it.
Uh-huh.
And it's severe and it's persistent and it's annoying. I mean, I have patients that I get on treatment and they're so uncomfortable. They may bolt and go to the emergency room in the middle of treatment because
Wow.
they just can't stand it anymore. And they end up, doctors telling them they don't have it and doing CT scans on them and stopping their medication, and then we have to start all over again.
Oh, that's frustrating.
But, in my experience, we can definitely treat this. And that's why I brought up David Brady, because he agrees with me that the best way to treat this is naturally.
Right.
With natural.
Because with antibiotic treatment, it very often SIBO will recur.
Exactly.
Right? It just comes right back.
It just comes back.
Yeah. And then you've also decimated your good bacteria population.
Exactly.
Leaving you ripe for candida. Now you've got large and small intestine problems.
Exactly. But sometimes if people are so terribly symptomatic, they're not responding fast enough, I will give them the antibiotics and then immediately follow up with the natural medicine.
Right.
Intestinally coated oregano I find to be very helpful. Berberine, of course, is really good.
Berberine's one of my absolute favorites.
Yeah,
for so many things.
Well, there's
for this,
90 different things that it can be used for, right? So those are my two favorites. And then, of course, like I said, I look at the microbiome, so I see what else is there. We do quantitative RNA testing through Diagnostic Solutions. Mm-hmm. Very good company. I'm really pleased with them. David Brady uses the same, as it turns out.
And so are they testing, is this from a stool test?
Mm-hmm.
That they look at that?
Mm-hmm.
So there's kind of two ways that one can test for SIBO, right? There's the breath test.
And I do the breath test.
Right. And I bring this up.
But it's not 100%.
That's exactly why I bring it up, because the breath test, they'll look for hydrogen and methane. But from my understanding, there can also be hydrogen sulfide being produced by SIBO, which is not necessarily tested for.
Right.
And there's not set parameters necessarily that have been established on a wide scale for what breath test results mean you have SIBO and what doesn't. So I think it's amazing that you have used the combination of these two tests as kind of a checks and balances to have a higher degree of certainty.
Yeah. I think the main thing is your clinical. Mm-hmm. I say a test is only as good as what it shows you.
Right.
If it doesn't show you and you still have this symptomatic patient, you don't tell this symptomatic patient you don't have something.
It's amazing when doctors kick you out of the office and say, there's nothing wrong with your tests.
Right.
Your symptoms are
fine.
Just,
No, I don't. Yeah, you got to go with what's happening with your patient. So.
Yeah. So,
although I will say I've never seen anybody with a completely negative breath test and a completely negative stool test. I'm not seeing that.
So everybody's got. So if the symptoms are there, always something will come out.
Yeah.
In those tests.
Yeah.
Mm-hmm. Is SIBO like a scale where everybody's got a little bit of bacteria in the stomach, and some people have more, and some people have more, and some people have way more? Would you say, or is
you
it
mean
more
in
like
the small intestine?
Yeah.
Is
it like an on and off thing? Like either you have it or you don't? Or
I think we'd have to do small bowel endoscopy and test everybody to know that. I don't know if that data exists.
We don't have enough people signing up for that test, I guess.
And it's very expensive, because that is another way you could diagnose it, of course.
Right. My mom actually had it tested in that way.
Really?
She was experiencing some symptoms that she has a bad taste in her mouth that she hasn't been able to deal with for years, and has come at it from many different angles. And she was, due for a colonoscopy, and so they said, well, why don't we check your small intestine as well while we're going? And it wasn't SIBO. But yeah, so that is, I guess, the ultimate.
That would be
most highest certainty way to test.
Exactly. Right? But it's too expensive to do for everybody, and I think we can get at the answer with these other tests and with our clinical acumen, you know?
Right. Yeah. Putting together, kind of triangulating between stool test, breath test, and symptoms, right? So what we got into a little bit a moment ago with berberine and with the oregano, but what do people do dietarily if they're dealing with SIBO once they've had a test done?
Okay, usually what I ask people to do, at least temporarily, believe it or not, is because they have too many bacteria in their normal category as well.
Right.
Is what you'll see on the stool test.
Oh, interesting.
Yeah, so, and maybe that's because people are more tuned into taking probiotics or fermented foods.
They've tried to do something already.
I ask them to not take fermented foods and to avoid gas-producing, like cruciferous vegetables, broccoli, cauliflower, cabbage, things like that, because they produce gas.
Yeah.
And it helps. It helps, and I also ask them to remove refined carbohydrates. And then I'm a big no gluten fan, so I throw that in.
Yeah.
Because I think it makes the gut healthier and better able to resolve itself. Whether or not that's adding to the gas problems, I don't know.
Right. You just stack the odds in your favor rather than your body having to fight against gluten while it's also trying to heal the SIBO situation, right?
Exactly. And alcohol, which is sugar.
Yeah. Yeah.
And also causes leaky gut in and of itself. As does gluten or zonulin. Right. Is associated with that.
Yeah. So do you often find, now looking at kind of three things that seem to often co-occur, and I'm curious to know what you think their connection is, if one is causative of the other or if they are just caused by the same third-party kind of factor, but you see leaky gut, you see SIBO, and you see IBS happening rampantly these days with people. What do you feel is the link between those? Is it a combination of many things? Is there one thing that kind of connects them?
I think there are a few things. If you think about it, and I like to think big, I also like to think really small, but what do we have now that we didn't have before? And the thing that we have more that's more prevalent than anything is stress.
That's what I was just about to think, yeah.
We have more stress, and everybody has this sense of urgency. And we run around with this sense of urgency, and what does that do? That makes flight or fight neurotransmitters, that makes toxins in and of itself, which kill off the good bacteria in your gut and, open the doors for what I call the gangsters to move in and take over, and maybe
the gangsters, that's so good.
maybe the methane-producing bacteria to take over and start causing problems. Now, that could be the beginning. That's your leaky gut, and then when that goes, then your membrane permeability is not working. And the other thing we have, and I think about it, is toxins. Right. Glyphosates. Glyphosate is a very strong antibiotic. Right. So it's shifting our microbiome. And whether or not this lady that spoke at the conferences last week talked about her microbiome, and she was overcoming some health illnesses, and she said she was eating so pure and so clean, like, probably you and I do. Yeah. And she was testing her urine she still tested positive for glyphosate. It's pretty much in the air. And she goes, where's it coming from? And so it told her that, it's not just the food. But the other thing we have to think about is water. Because it can be in the water. Right. And so if it's killing off all the bad things on, herbicides, pesticides, fungicides, it's doing the same thing in us. It's a potent antibiotic.
And it's designed, as I understand it, to explode the stomach of bugs that would try to eat the plants, right? And we think, oh, well, clearly it's not exploding our stomachs. Nobody's walking around like with their guts pouring out. But on a micro level, it is right in line with how much leaky gut we're seeing in the world, that it's creating these micro holes in the gut and breaking open those tight junctions. And then for people who are new to the idea of leaky gut, the small food particles can then enter into your bloodstream, right? And good bacteria can't properly settle in.
Yeah, and the polysaccharides from the gram-negative bacteria will, and then that causes more toxicity.
Right, and then now you're dealing with autoimmunity and chronic inflammation.
Yeah, well, we know now there's certain bacteria associated with autoimmunity, and that's the other reason I do the stool testing. There's a bacteria called Provotella. There's a bacteria called, I'm sure you've heard of, Klebsiella and Citrobacter, which are definitely associated with autoimmune.
Yeah, those
changes.
are the real gangsters.
Yeah, when I see those, I've even had people come in and I check their thyroid, and one of the things I like to check, other than the free T3, free T4, I check a TPO antibody, which is antibodies against your own thyroid.
Right, thyroid peroxidase.
Antibodies, yeah. And when you find those, you think Hashimoto's.
Yeah.
But if you can find those antibodies and immediately clean up their gut, and I've done this, the antibodies go away and their risk for getting Hashimoto's is over.
That's amazing.
Right? Isn't that great?
That's spectacular.
Yeah. Because you're saving them from a life.
That's it's horrible.
You're saving them from a lifelong commitment to taking thyroid.
Right. That's what I always say to people whenever the thyroid conversation comes up is try doing everything natural possible before you get on a medication. Because once you're on it, you're kind of stuck.
Yeah. But you have to...
In certain cases, it's necessary, I'm sure. But it's worth giving all natural means, such as dealing with gut issues, a shot to maybe you don't have to take thyroid medication the rest of your life.
Yeah.
But as medications go, it's not one of the most evil in terms of side effects. And
you're addicted to it.
That's right.
Once you take it, you have to have it. And anybody that's a thyroid patient knows that, and thank God we have it.
Right.
But if you test for it and you can pick it up early
for the antibodies,
you can reverse it. Yeah.
That's amazing. Is there a connection, do you think, between thyroid and SIBO? And I just hypothesize this because it seems that one of the hypothesized causes of SIBO is a lack of proper stomach acid levels, and the thyroid has such a role in metabolism and digestion. Is an underactive thyroid kind of setting the stage, perhaps, for SIBO to
I hadn't really made that connection, but you could be right.
That's just me hypothesizing.
Yeah, to me, it's more about the acid thing you mentioned.
Yeah.
Because there's so many people that go, oh, I have a little reflux, let me take some over-the-counter Pepsid AC or famotidine, let me take some Zantac, or ranitidine, or even worse, Prilosec or some kind of potassium ATPase proton pump inhibitor, which totally removes your acid. When you remove the acid, that's your first line of defense.
Yeah, and now you're no longer getting nutrients out of the food.
You don't, because you're not activating your digestive enzymes if you don't have the acid. But the more important thing, you're not killing off those gangsters.
Right.
They're getting straight in. Just open the door, And,
you're very welcoming to them.
Yeah, so there are very many natural ways to treat, reflux, which is another subject. But
yeah, well, I'd love to go a little bit down into that area of digestive acids and how to increase that, because it's very interesting here, because as people age, they usually produce less hydrochloric acid, right, and fewer digestive enzymes.
They usually do,
average.
But you can train the body.
You see more SIBO as people get older. It occurs more in an older population. But I'd love to hear your thoughts on how you can train the body, as you said.
Yeah, a lot of people just knee-jerk practitioners.
Yeah.
Here's some digestive enzymes.
Right.
I'm all into biomimicry, and I'm all into trusting the body, knowing the body, trying to get the body to do what it already knows how to do.
Yeah.
So I love bitters. Because if you give a person bitters, it says, okay, the food is coming, make some digestive enzymes.
Yeah.
You can actually train the body. You can actually get people off these drugs that I had mentioned before for reflux by giving them bitters. And before they eat, and then their body will begin to make enzymes more and more. And it isn't necessarily young people.
Right.
All the time.
Yeah.
So it's biomimicry.
As long as it's still got a spleen and a gallbladder.
And a pancreas.
And a pancreas, right? There's something you can activate there.
Yeah, and but there are bitter receptors all the way. They're everywhere. They're in your brain. They're not just in your tongue. They're from here all the way down. They're throughout your body. So by taking, Standard Process has a great product called Digest Forte.
Okay.
It's a great mix of bitters.
Yeah. And
if you take it right before you eat,
is it a liquid, a tablet?
It's a tablet.
So that's easy. People don't have to deal with the taste.
Yeah.
So much.
Yeah, you don't have to.
Because I've seen lots of liquid bitters that people like you and I who are hardcore can enjoy it.
Yeah.
But it's for some people, it would be kind of a barrier to have to deal with the bitter flavors that they're not used to.
Yeah. No, it's a great way to do it, and it can retrain your body to make your proper, digestive enzymes.
Oh, that's very cool. Yeah, that's fantastic.
It's partly how I get people off those medications.
Right, and it's so funny because it's the exact opposite of what many people would initially think is the solution. If they're having heartburn and acid reflux, they think, oh, this is too much acid. I need to take down my acid, when in fact, by getting your body to produce more natural acids, that's the way out.
And the Chinese know this because I've studied some Chinese medicine as well. It's reverse stomach chi.
Yeah.
People with SIBO, people with bloating, people with even leaky gut get reverse stomach chi.
Yeah.
And then they get reflux.
Right.
So if you give them bitters, treat the imbalance in the gut.
Right.
So with some of the ways that we discussed, it corrects itself. It gets it going the right way.
So we talked now about diet and gut health practices. How about in the category of like supplements and herbs? What are some of your favorite supplements and herbs to incorporate with SIBO?
For SIBO, I mentioned it earlier a little bit, but for the cidal effect, or getting rid of the bad bacteria, the methane producers, although it'll get rid of across the board, all the bad bacteria, is enteric-coated oregano. And it's called Gut Flora by Standard Process.
And enteric-coated, for those who are not familiar with the term, is so that it doesn't get absorbed too soon.
Yeah, right? Oregano oil, it does work, but it's very hard to take.
Yeah.
It burns, it's difficult.
Right, and so you wouldn't want somebody just taking a bottle of oregano essential oil and just putting that in their mouth.
Although people do, but I think a much better way is to do it enteric-coated, and you wouldn't even know you took it.
Right.
Yeah. It's awesome. There's no rebound.
And it can actually get to where it needs to go.
Mm-hmm.
Yeah.
Yeah, so I love that. And of course, we mentioned berberine. There are a lot of companies that make really good berberine. Actually, you can tell I like Standard Process. But they have organic herbs, and they're sourced from all around the world. Best places to grow them, and I've visited these places.
Oh, wonderful!
Yeah, I've visited the farm, so I'm really impressed with them, and their herbs are way more potent than a lot of other ones. But I'm sure a lot of sources.
Yeah, no, sure, certainly with herbs, there's huge variations in quality and in potency and purity out there in the market.
Yeah, so that's why I do these site visitations and pick the best ones.
That's so good.
Yeah.
Yeah. So berberine.
So they just came out with berberine active. Which I love. So that works very well in the mix. And then there's something from Designs for Health that has a little berberine in it, but I like to use it if there's parasites involved, because it has black walnut, or else I'll use just black walnut by itself. For parasites, you got to look and see what's there. Right.
So parasites and bacterial and gut issues can very often be co-occurring.
Oh yes.
And it's hard just to heal from one if you don't heal from all.
It's funny because back in the late 80s, I think it was, I was looking, I'm always wanting to know why is this? What's in there? And so, I was doing stool tests. I was working with a company they were called then Great Smokies.
Oh, I know Great Smokies.
And now they're Genova Diagnostics.
Right, well, and but there's also now Great Plains, who they kind of split a faction out of. They keep splitting and changing names. It's so funny. Yeah.
But anyway, they did stool testing, and everybody back in the day, this shows you how much things have changed.
Right.
Thank goodness for us.
Yes.
And our people, that, everybody thought I was nuts. It doesn't matter. It's commensal. Commensal meaning it belongs there, or it's always found there, or it doesn't really cause any problems. And we're talking about yeast. We're talking about blastocystis. We're talking not just a parasite or other parasites. And I'm going like, I don't think so, because I was working in the inflammatory bowel disease clinic and in the irritable bowel disease clinic, and I was finding big differences from just regular people. Yeah. And so I began to do it clear back then. I was looking into the microbiome.
That's amazing. Yeah, it's so fortunate for everyone who has had the opportunity to be in front of you and get this wisdom from you when it was not generally accepted for so long.
Thank goodness it is now, and that we're looking at these things. Although there's some argument about what kind of stool testing and this and that, but I prefer the R quantitative RNA testing. There's another test by Thorne that's really good, which is DNA.
Uh-huh.
Yeah, but I think it's pretty equivalent. But to get to it is a little more difficult for my patients.
Okay.
But the test is good.
Yeah. So either is it with Genova Diagnostics who you normally
there's Genova Diagnostics
the mRNA
also.
test with?
No, it's Diagnostic Solutions.
Oh, okay. So the kind of the two options for the stool test here would be the Thorne one for the DNA, or Diagnostic Solutions for the mRNA
although
test.
Genova has added a genetic part to their stool testing, so I don't want to discount them because
right. No, they do a lot of great stuff as well. Of course, they're wonderful.
And I do nutrient testing with them.
Right.
So
okay, great. Well, thank you so much, Dr. Randall. This has been wonderful, insightful. I'm sure people have learned a great deal from this. I'd love to send all of you guys to Dr. Randall's website to check her out. It's was spelled just drgmrandall.com, and you can also find her on Instagram. You're Dr. Gayle Randall on there, is that right? Mm-hmm. And she puts out a lot of great educational information as well. I think you guys will really enjoy it. Any last thoughts you'd like to share, Dr. Randall?
No.
Okay.
I love you guys. Come see me.
We love you too, Dr. Randall. Thank you so much for sharing your time with us and sharing your wisdom with us.
My
I really
pleasure.
appreciate it.
Okay.
Thank you so much.